All right, good morning, everyone. Welcome. Welcome to Healthcare Repeal 101. All right, good morning, everyone. Welcome to VICA's 29th Annual Business Forecast Conference and the Healthcare Panel. My name is Ross Pendergraph with the Levitt Group, one of the panel's sponsors, along with Valley Presbyterian Hospital. I'd also like to recognize our track sponsors, the Garland and Kaiser Permanente. It is my pleasure to welcome you, all of you, to the healthcare panel this morning. I also get the honor of introducing our moderator and panel today. Our moderator today is Carol Kim, Vice President of Community Investment and Public Affairs at HealthNet, a VICA board member and co-chair of the VICA Healthcare Committee. The biographies of all the panelists are already in the journal, so I will not go ahead and read the full biography, so that'll allow us more time at the end for questions. So in alphabetical order, we have Jeff Alport, Vice President, Chief Information Officer for Valley Presbyterian Hospital, Dr. Eric Dutson, Executive Director for the Center of Advanced Surgical and Intervention Technology at UCLA, Dr. John Rott, Physician Director for Kaiser Permanente, and Dr. Brennan Spiegel, Director of Health Services Research for Cedars Sinai Health Systems. So on with the show, as they say, and thank you for participating in today's panel. And now let me turn it over to Carol.
Thank you, Ross. Good morning, everyone. Thank you for joining us on this Friday. There's really nothing going on in our world, as we all know. But before I begin, I do have to get some administrative items out of the way. I've been asked by the VICA staff to really encourage each of you to please complete your exit survey at your seat. And at the end of the panel session, if you would be so kind in turning those in to the VICA staff or intern or ambassadors located somewhere in the back of the room, that would be greatly appreciated. So thank you. So it's been quite a year, and the year's not even out in our world, you really can't read the newspaper or listen to the radio without hearing about something going on in the healthcare world. But this morning's panel discussion is really going to focus on a lot of the incredible innovative work going on in the healthcare sphere. And so I am really looking forward to this to be an interactive dialogue with our panelists and each and every one of you. I'm going to give each panelist a couple minutes to give some opening remarks, and then I will toss out some questions to help get our conversation started. So with that, I'll go ahead and ask Dr. Spiegel if you would be so kind in making some brief remarks.
Sure. Good morning, everyone. Thank you for the invitation to be here today. So just by way of background, you heard my background. I direct health services research at Cedars Sinai, and health services research is about how to improve the value of healthcare. How do we improve the quality and outcomes of care that we deliver as a healthcare system? And how do we do it at the lowest possible cost of care? So we're interested in that value equation. I also teach health economics at UCLA and at Cedars Sinai. So I'm a physician and sort of health economist. So I'm always thinking about when we have new biomedical innovations, how do we think about them in terms of this larger picture of value-based healthcare delivery? So my group at Cedars Sinai is really focused on trying to improve the value of care, particularly using technology. And I'll be brief now, we'll go into more examples shortly. But technology and digital health science in particular, has transformed our ability to deliver healthcare. And I'll just sort of set that aside for the moment. We can come back to that concept. But I'm really focused on understanding how do we use wearable biosensors? How do we use the electronic health record? How do we use social media and social media analytics? How do we use smartphone applications to truly engage people where they live, work, and play, which is nowhere near the hospital? People spend 99.9% of their lives far away from us, far away from the brick and mortar of a hospital. We have to engage them where they are. And if we don't do that, we're going to miss out on huge business opportunities and, most importantly, healthcare delivery opportunities. So that's what my focus is.
Great, thank you. Jeff Alport.
Yes, hi, I'm Jeff Alpart, and I'm the CIO and Vice President at Valley Presbyterian Hospital. You have a handout in your packets which describe a little bit of some statistics about Valley Presbyterian, but one thing of note is we are a major Medi-Cal healthcare provider, and that presents really interesting challenges for us as a healthcare delivery organization. As you would imagine, my role is to be in charge of all the technology that we use at Valley Presbyterian. And it's an interesting time because there is almost nothing that one can do anymore in healthcare without taking some part of technology um, into the process. My CEO, Gus Valdispino, mentioned to me the other day, he said, I'm never would have imagined a medical executive committee meeting being dominated by discussions about the electronic health record. But that's almost every topic we have at the MedExec generally involves something about the technology. So it's an exciting time in healthcare. I think you'll hear about that as we talk because there are so many initiatives underway right now that impact all of us that involve technology. Thank you.
Hi, my name is Eric Dutson, and as mentioned, I'm the Executive Director for the Center for Advanced Surgical and Interventional Technology at UCLA. To give you a quick rewind on my professional career, I trained in the 90s. I went to medical school in the early 90s, and I did my surgical residency training also in the 90s. I worked for a year after that, and then I went to back to fellowship, because I recognized that this new type of surgery that people started doing in the 90s called laparoscopy looked like it was something that was probably going to really take root. We did about one operation in the 90s, maybe two, regularly, and I could see that that was going to transition soon. So I went back to get additional training in that, actually in a location in France, where not only were they doing a bunch of very focused research on minimally invasive or laparoscopic surgery, but they were also looking into robots and computer-assisted surgery. So I got this wonderful experience, and while I was there, we did an operation that no one ever heard of. And the reason no one ever heard of it is because the press release was scheduled for September 12th, 2001. So on September 11th, the entire press and the entire world was focused on something very different. So what that operation was my boss in France went to New York City, and in the France Telecom building actually performed a cholecystectomy, which is removal of gallbladder, from the patient that we had with us in France. And this is something nobody ever heard of. And even if you tell people that today, they're like, wow, can you really do that? So that opened my eyes, and for the people who were watching this event, they realized, as our speakers have already said, that the digital age means that we have to rethink the way we do everything, and the potential to do things better, more precise, safer, is enormous, and we're really only limited by our imagination. So my work at UCLA, I've been there for 14 years now, has been very focused on not only the technological development of robotic capabilities and other minimally invasive surgery capabilities, but also the training of it, because we learned some hard lessons in the 90s when we implemented some of these new technologies. And I also, as a clinician, implement these things that we're working on. So I look forward to the discussion today.
Thank you. Dr. Rott.
Hi, John Rott. I'm Regional Assistant Medical Director with Kaiser Permanente with a deep interest in telehealth. I think we're in a time where the health industry is being disrupted. Change is coming at an incredible pace, and it's very difficult to know what's real and what isn't. There's a lot of smoke and mirrors, a lot of things that are tried and then have failed disastrously, hundreds of millions of dollars going down particular holes. So at Kaiser Permanente, because we are primarily a capitated value-based system, we have a deep interest in figuring out what's not just going to be cool and convenient, but what actually drives efficiency and quality. What's going to deliver better health care. So I look forward to sharing more of that with you. And in addition to that role, I'm also a practicing general pediatrician, and I use these technologies. So I'm doing video visits, scheduled telephone visits, using our electronic record system and dealing with the issues of interoperability myself. And so I can comment a little on personal experience.
Great, thank you. Um, on that note, there seems to be quite a bit of emphasis around technology and the development of technology in the healthcare space. I know for myself, I probably like a lot of you, we all have our Fitbits and Apple Watches, and kind of annoys me because it's 11 o'clock and I look at it and I only did like 1,251 steps and I'm fine. But on that note, Dr. Spiegel, just curious, you mentioned, wearable technology and apps and how we need to think about the interface between patients and doctors, and where's the nexus with some of this technology. Um, how do we know that patients will indeed be assured that they are receiving the proper treatment at the appropriate time? Do you see us getting to a place where we rely more heavily on the new technology and apps that sort of allows to some degree quote unquote self-diagnosis?
There's a lot packed into that question. I'll do my best to unpack it quickly. Well, I'll start by saying that about 2 years ago, Cedars-Sinai was among the first in the world to offer access to our patients to connect their wearable data directly to our electronic health record. So we invited 86,000 of our patients to connect their data through Apple HealthKit, through Fitbit, and to start pouring the data in. And you might think, before I tell you the answer, how many people actually decided to take us up on that offer, right? I won't make you guys guess, but you can maybe put a number in your head. What percentage of people do you think took the time to connect to our electronic health record? So the answer was 0.7%.
Wow.
Okay, about 450 people. And those people tended to be younger, white, healthy employees of Cedars-Sinai Health System.
Not your target audience.
So we wrote a paper about this, and you can look it up. It's open access on a journal called PLOS1 that was published earlier this year. And what that taught us is that if you build it, they will not come. There's no reason why somebody should want to start sharing their data with a health system without understanding where is it going, is it secure, how is it being used. And on the other side, the physicians say, wait a second, whose responsibility is it to monitor all this data pouring in? What if somebody has signs of a heart attack? Medical legally, am I responsible? I'm too busy in the clinical trenches to be managing data pouring in off of all these sensors that sound wonderful. So we can talk for another hour about this, but the short solution to answer your question is we need a new type of clinician. This person is going to be called the digitalist. The digitalist, I think, will be trained, and there will in fact be training specifically for this individual who will sit in an e-coordination hub, is trained in clinical medicine, is trained in digital health science, social science, computer science, is able to actually monitor the data that's coming in and integrating that and making contact with patients out in the real world while the rest of us are in the hospital or clinic managing our day. So we can talk all about the digitalist model in more detail if you're interested, but the long answer to your question is if you build it, they will not come at all. There's still very little evidence that wearables make a lick of difference in people's lives, and we've just published a meta-analysis to demonstrate that. And I can go on and on, so I'll stop there. I'm sure these guys have some ideas.
So should I ask Apple for a refund on my Apple Watch, given that
Not-
there's little return?
Well, it depends why you purchased it. Apple's made no claims that it's going to help improve your health-related quality of life, survival. That's the difference between an FDA-cleared, FDA-approved biomedical intervention and a consumer-facing product. Let's not confuse those two.
Interesting, because I think with respect to technology, we also think that technological advancements should contribute towards reducing what we all know as the healthcare cost curve. And I was curious, perhaps Dr. Rott, if you would be able to address that. I mean, any thoughts around where technology and the usage of technology can help bring down the price tag of healthcare delivery?
You bet. And before we leave this thought on the wearables, there is opportunity there, depending, but where we found success is when it's been targeted.
Yes.
So we have a program we call virtual cardiac rehabilitation that's been remarkably successful. And it's a smartwatch program. We give people, so people who've had a heart attack, we give them a smartwatch that's linked up to their phone, and it guides them through, step by step, the appropriate rehabilitation after their heart attack. Without that, using a nurse calling, written materials, we got about a 40% uptake, success in completion of cardiac rehab. With the watch, we got our participation completion of the program up to 80%. So the technology enabled, accelerated that program that we already had in place and cut our mortality rate, our death rate, by 30% after heart attacks. So clearly there are places where it's incredibly effective, both in terms of quality, cost, and value. But we find that just like you said, the general using a wearable it has not been very valuable. But the highly targeted interventions for chronic disease are where the money is, and it makes sense because 85% of healthcare costs in America are directed to taking care of people with chronic illness. If you think you're going to save a lot of money taking care of, the people who aren't ill, that's not where the bulk of the expenses are. So programs that target those things around diabetes. So we're expanding our wireless glucometer pilot for people that have out-of-control diabetes now. That's rolling out to all our medical centers. Another successful intervention. Now at Kaiser Permanente, if your diabetes is under great control, we don't put you in that program because you're doing fine. It would be wasteful. We believe very deeply in value in using the things that people need. Now to get, one more thing, and then
I just want to add that we have a similar program for cardiovascular, and we have an 86% adherence currently with the wearable. So very similar results.
It really is a miracle for those people. Everybody should be on that if they have a heart attack. Just one more thing. I don't know if you guys are familiar with the RAM study. So the notion, I think, among a lot of our business partners is that if they add a telehealth vendor, their employees will utilize that instead of going to the clinic or emergency department and save a whole bunch of money. Kind of makes sense back of the envelope. Rand did a big study with CalPERS looking at was there a return on investment for this. They had 300,000 members, CalPERS big population, and they had a clean control group. So instead of just looking at the number of visits that the population had, they could actually compare it to the number of visits to a population that didn't have the telehealth option and see what happened. And they found that costs went up in the visit that had the telehealth option. Very surprising finding. And the reason they said was 88% of the telehealth visits were new visits. They're visits that wouldn't have happened anyway. So by making things so easy, so convenient, they drove up demand and ended up spending more money than they otherwise would. I think that's a really important caveat for us to think about going forward is look behind the curtains and mirrors and see does all the math really add up and make sense. In our program, we don't do those sorts of things directly on demand like Teladoc does. We try and capture people calling in for an appointment so that we're actually saving an appointment, and we've got good data to show that we do that. But you don't want to make it too easy. Anyway, it's an exciting area.
So, Dr. Rott, that sounds really fascinating with the virtual cardiac smartphone app, really targeted towards patients who had the misfortune of having a heart attack. But it also seems like you can still never get away from the need for surgery and being in the operating room. And I wanted to ask maybe perhaps Dr. Dutson, any thoughts around where technology and the development of new technology are coming into operating rooms and how it interfaces between surgeons and the medical staff and the patient outcome?
So that's a really important question, I think, because as we make economic decisions about what we're going to spend on technology, especially in the operating room, we want to see that it actually benefits the patients. In some ways, it's difficult to justify the expenses that we have in the operating room. If you look at it, the operating room bill, it's enormous when we look at healthcare expenditures. And new tech is always more expensive, always. What we learned back in the late 80s and 1990s when we introduced laparoscopy, which was minimally invasive surgery for various types of things, but it's predominantly for the operation of cholecystectomy, we found that patients did much better. If you don't know anything about medicine, you know that a smaller incision hurts less than a bigger one. Okay, so that's obvious, right? So there was an obvious benefit to it, and when we began to study the effects of laparoscopy versus traditional surgery, we found enormous benefits. And then people said, well, wait a minute, this development of technology is completely driven by industry, because they were making all of these disposable pieces of equipment that we've gotten away from in many ways now. But there was a huge economy behind the development of minimally invasive surgery. But because people are out of work for less time, they had less pain, they were back at their job within a week rather than within 6 weeks. And because their overall immune suppression and outcomes were really quite good after we started getting more proficient at it, the economic argument was easy. Nowadays, we have a new thing that's coming. I gave you a tidbit when I talked about the Lindbergh operation, which was in 2001. Now we have robotic surgery and the integration of computer-assisted surgery. It relies on the same minimally invasive approaches, but the platform is digital, which means we can do a lot more than simple analog images. So one of the things that we work on at UCLA, in addition to implementing the things that we've established are safe, is ways to make the surgeon-robot interface as ergonomic and beneficial as possible, and also ways that those technologies are going to benefit the patient the most. For example, in Los Angeles, it is the standard of care to perform prostatectomy with robotic assistance. That's a pretty big jump because the data doesn't necessarily support a superior operation, but the surgeons have a huge preference for it because they can operate in a sort of uncomfortable position, what was traditionally an uncomfortable position laparoscopically, and carry out procedures that are pretty challenging to do from a motor cortical standpoint in very small spaces within the bony structure of the pelvis while they're sitting comfortably at a console and not getting neck strain, shoulder strain, back strain, and the things that surgeons are prone to get, like C5, C6 subluxation after a career of looking down like this. Those are real issues. One of the types of surgery I do is obesity surgery. I can tell you that if I'm operating on a 500-pound patient, if I can sit at the robot and let the robot take the physical stress of that operation and still offer it from a minimally invasive standpoint, that makes a huge difference. And it benefits the patient because I'm not going to quit halfway through and say, I can't do this. We have to open up, because then that introduces a whole new set of complications. We are interested in the patient getting the maximum benefit, obviously. And in order to avoid the mistakes of the 1990s, which was we saw when we introduced laparoscopy that there was a 300% increase in something called a common bile duct injury. And that was simply because people were not adequately trained to start using the technology that was available. We also saw in cancer that the cancer local recurrence rates also skyrocketed to the point where there was a moratorium declared on performing colorectal cancer surgeries via laparoscopy until a 10-year prospective randomized trial could be done to show that the outcomes in an adequately trained person were actually okay. So what we learned from that now as we introduce the robot, which is really substantially more complicated from a tech standpoint, we've learned that as we develop the tech, we really need to make sure that the surgeons have demonstrated proficiency, because that did not happen 2 decades ago, and the patients paid the price for that. So the intention now is to make sure that people people show a minimum amount of competency before they get in the operating room, before they get credentialed. And we have various ways to do that. Computer technology now, as you all have heard of Moore's Law, has grown geometrically, meaning that our capability to do virtual representations of what we do in the operating room gets better every day. Every hour of every day gets better. So what used to be sort of crude video games, we're now actually starting to use actual patient data based on DICOM imaging and morphing those into interactive virtual systems that we can interact with and actually practice our surgeries the same way that pilots practice before they ever get anywhere near a cockpit. The physical world is much easier to represent in virtual reality than a biologic system. A biologic system is 3 orders of magnitude more complicated just by definition. So it's difficult to do some of these things, but now that we're working with our engineers in the School of Engineering, our computer scientists, we're actually able to generate virtual physics-based models of what we do in the operating room and operate in a very safe way so that when surgeons get to the operating room to execute that operation, they actually have a demonstrable expertise at it. Those are all potentials that are starting to come into the full right now. So we're very excited about this sort of work because we think we can get it to a point where it's much better than it ever has been. And if you look at surgical outcomes and complication rates over the last 20 years, they've been steadily declining for reasons that we don't really have a good fix on. I think it certainly is attributable to some of our technologies, but I don't know if we can define it properly.
So lots going on from a perspective of robotics, virtual reality, wearable tech, apps. In thinking about all of this technology and innovation, Jeff, and I'd like to, throw this question at you, and you may want to kill me at the end of this as I throw this question at you. But where do you see some of that work having the most impact from the work you do as Valley Presbyterian Hospital in that hospital setting as a microcosm within the larger hospital system in the country? And what are some of the things that keep you up at night when you think about technology, innovation, and how we need to think about our greater healthcare policies?
Great, thanks, Carol. The great joys of technology are what lead probably all of us into the careers that we have. As Carol indicates, I have the unique responsibility of making sure some of these technologies actually work in a community hospital setting. And that's challenging because, as you heard from our other panelists, there's an infrastructure that sort of needs to be in place for many of these things to work well. Some of the things that keep me up at night are understanding really, as I listen to my colleague here talk about surgery, I want to make sure that something doesn't fail in the middle of that surgery. Power, electricity, air conditioning, data center integrity. There's a huge number of things that just need to be functional all the time. And what that does is it leads to a greater and greater investment in an infrastructure that also provides security. And I think all of you have seen many stories over the last several years in the news about data breaches, security gaps, and so on. And these are exciting times and they're dangerous times. They're exciting because of these technologies, and yet every one of these technologies in some form or another is hackable, and we have to think about that all the time. So healthcare is one of these microcosms, I think, where the technology is very exciting, but you're constantly bumping up against barriers on how to implement them the most effective way. Sometimes those are the things that I was just talking about, like infrastructure in a hospital, security, and so on. But you can also expand that and think about your patient population. I think the 0.7% willingness of someone to connect their digital measurement tools into a hospital is a great example of possibly a technology being slightly ahead of a community um, consensus about what to do with that technology. So a couple of things related to policy that I think are somewhat hidden when we talk about technology, but may be helpful for folks to understand, is if you imagine a great technology, take something very consumer-oriented like Uber or something like that. Those technologies in the app world are driven largely by consumer demand. We all want to shop on Amazon a certain way. We all want to, get ride sharing a certain way. We want to find vacation rentals a certain way, and that's all driven by us as consumers. But I'll challenge you to think about some things like any of us that have had a physician visit in the last 5 years probably had an opportunity to connect with that physician by email, create that appointment through some kind of web portal, get the reminders driven to your email for that appointment. Probably when you got there, if you had one of the results of your physician visit was a prescription, you were probably asked where your local pharmacy was, or you were simply asked to confirm where your local pharmacy was, and then your medication would be there upon pickup. You didn't walk out with a piece of paper that said, let me go get my prescription at the local pharmacy. You would say, I think, wow, this is great. Healthcare has a consumer-oriented approach to technology. The hidden fact is most of those initiatives were driven by incentives from the federal government. And so all of us in healthcare are continually striving to achieve some demands that are coming for anybody with expecting to receive CMS payments for reimbursement, whether it's Medi-Cal or Medicare. And in those cases, we have to demonstrate a certain use of technology. This is a great example where policy is driving a technology, but some of those technologies the population is not quite ready for. So in the coming years, we will have to demonstrate to the government our ability to connect with these patient-supplied data sources for the population that might only be 0.7% ready to participate. Okay? So if you have a great program like the cardiology program that was referred to, you have a chance to sort of demonstrate some of that. For Valley Presbyterian, very challenging, primary Medi-Cal population without a huge primary care network. When you say to one of those patients, connect with your healthcare community digitally, the challenge would be, who is that healthcare community? I'm not sure I know who that is. Do you mean my emergency room? Might be what they would say. And so there are challenges taking these great technologies and putting them into place where our policies are asking healthcare to be the most effective. So once again, that's one of the challenges in a role like mine.
Yeah.
Yes,
Can I make a
absolutely.
comment? So now at Kaiser Permanente, 58% of our provider patient touches are happening virtually. And that's been true for about 5 years. More than half of our encounters are taking place virtually. It's a dramatic shift in how we practice medicine. I think a lot of people, when they think about telehealth and new technologies, they're thinking about video, but the bulk of it is what you were just saying. Email has been the channel that has really been transformative. Nobody has to play phone tag. The technology is well proven. Everybody carries it around in their pocket. You shoot a picture and it comes right to the physician. As a pediatrician, I regularly get pictures of poopy diapers and crazy rashes. And the truth is I can handle about 90% of those rashes and the general things that I get over email without having somebody come in. So that's key. The other key to it, though, is the incentives. And it's important that you look at the providers. Are they incented in this to bring those patients in, or are they incented to handle the problem over email? Providers who are in the fee-for-service world, they may connect with their patients over email, but if they get paid for every visit they see in person, most of those emails they're going to say, you better come in and see me. As opposed to handling it, which is the University of Wisconsin did a study. This came out in July that showed when they gave they had a big group of physicians. I'm sorry, it was 90,000 patients. I don't remember exactly how many physicians access to email in a fee-for-service network, that they drove up in-person visits for just that reason, because these people were incented to bring people in. So looking at how those incentives are structured is going to be really important as all of us want to drive to a value in our medical care in the future.
Yeah, I think I have an example that may be helpful to tie some of these themes together. And we're talking about, in the operating room, we're talking about telemedicine in the community. Another form of virtual medicine is actually using virtual reality, or VR. And this is an example that has health economic opportunity, that has immediate impact on patient outcomes, and can reduce the cost of care. And what we've been doing is we've realized we have the largest hospital in the Western United States, and we have over 900 people sitting in our hospital, often suffering grievously. Make no mistake about it, being in a healthcare system is not a place of rest. It's not a place of healing. Our patients suffer physically, they suffer emotionally, they suffer socially. Digital health science is a biopsychosocial science, and that is absolutely vital for business success. For any digital health intervention, there has to be a social science component, a behavioral science component. There have to be people who are trained in this. There's all sorts of Silicon Valley entrepreneurs who are talking a big game about how they have the newest technology, and they're trying to find a place for it, when in fact they haven't taken the time to work with social scientists or work with the stakeholders in the trenches who are using these technologies, ultimately the patients themselves. So with that background, we realized our patients are sitting in biopsychosocial jail cells in the form of hospital rooms. And could we use virtual reality to engage them and allow them to escape the four walls of that hospital, to visit fantastical places, to go on a helicopter journey over Iceland, or to sit on the stage of a Cirque du Soleil performance, or to be on a beach and meditate. So we've done this with over 500 of our patients now, and have published multiple papers, and been able to demonstrate that this technology reduces pain by 25% without opioids, without medications. It improves their satisfaction. We're evaluating whether it shortens their length of stay, whether it improves their satisfaction scores, which 2% of CMS reimbursements are tied to. And we're now evaluating it in the community as well. I mean, just worked with a church in the West Adams district, looking at blood pressure reduction with a culturally tailored virtual reality intervention aimed at blood pressure management without any medications. So this is an example where we can take a technology, use the best practices of social science, decision analysis, computer science, digital health science, work with a multidisciplinary group of people to try and create value for our patients, and then measure whether there's a health economic benefit. So whether it's virtual reality or telehealth or robotics, all of these need to be subject to the same lens of evaluation and analysis. And that's what we do with cost effectiveness modeling, budget impact analysis, cost minimization analysis. So right now we're looking at the health economics of a virtual reality consult service, a virtualist, a new type of clinician who is trained in virtual and augmented and mixed reality and can tailor the prescription, get the right visualization to the right patient at the right time to treat their specific medical or neuropsychological condition. And it's been incredibly fulfilling, an example where I think digital health has tremendous opportunity.
That's a lot to take in, quite a bit, and I find it so fascinating in the description of hospitals being sort of a four-wall jail cell. I'll keep that in mind next time I'm there. And
we have a beautiful hospital.
No doubt. I think everyone has a beautiful hospital up here on the panel. But I am kind of curious to know, and I would like to take this opportunity to open it up to all the folks in this room, because I do recognize many folks here around the table who have been in the trenches for a long time. You know, we talk about quite a bit about virtual reality and tech and the innovation, but I am wondering, you know, from a consumer patient experience point of view, that day-to-day working mom and dad with children just trying to get access. Some of this stuff, I think, while fascinating and innovative and forward-thinking, part of me wonders, is it still a little bit too out of reach, or maybe a little bit at the risk of, you know, and by no means am I being critical, it's just a little bit too esoteric for the day-to-day working family just trying to get the access to care. And I kind of want to open this up, especially for those of you, Audrey and Jeff in particular, you know, who come from the community clinic, federally qualified health center world, and your medical team in particular, you know, working one-on-one with these families to get them on track with managing their health conditions. I just kind of am curious to hear from folks in this room, does any of this resonate with the patient member experience that you see? Yes.
Yeah, maybe I'll start. Sure. Some of you have different thoughts about that. Behavioral mental health is a pervasive. I mean, this is part of the human condition. Right, 40% of people are depressed at some point in their life. Anxiety, you know, post-traumatic stress. You know, this drives much. I mean, so much of the healthcare resource utilization, and it's so underappreciated. You know, I was trained in biomedical medicine. I'm a gastroenterologist. I pass scopes into people. You know, but most of what I deal with is concerns, worries, people feeling abdominal pain because they've really been abused, and no one's talked about it. So digital health's not going to solve any of that unless we make it solve those things. So I guess that's sort of more of a preamble to your question. But my thought is we need to work with behavioral scientists. We work very closely with our Department of Psychiatry when we're developing mobile health applications. We work with you know, people who understand, you know, human behavior. And some people think they understand that, but they haven't taken the time to understand that. You have to understand the stakeholders, do focus groups, cognitive interviews, work with people in the trenches and find out what are their unmet needs in their family, in their environment, in their community, and how can an app do anything in that environment. Not to say it can't, but there are opportunities, but you can't presuppose how this family that you're describing is going to use an app until you actually go out and find out from them how they're going to use that app. So part of this is just basic social sciences. It's about ethnography. It's about, you know, understanding knowledge, attitudes, beliefs, what we call KAB profiles, K-A-B, knowledge, attitude, beliefs, and preferences. And that is almost missing right now in digital health science. And you hear very little of that out of Silicon Valley. These entrepreneurs pushing these transformative, disruptive technologies that are going to change the face of healthcare. Forget it. They haven't spent 1 minute in my clinic, because in my clinic, I barely have time to use my own apps, my own biosensors, my own virtual reality headsets. So don't pull a fast one on us and think that we can do this all of a sudden. Can't. So we need a whole new rethink on who's going to be involved, how we're going to engage our stakeholders, and I think there's a lot of business opportunities around that as well. So I'm throwing a lot of stuff at you because that's a big question. I can't answer it concisely, but we can talk for another few hours about how to solve that problem.
Let me add one thing to that, if I may. We have a very busy emergency room, as with most hospitals these days, a very significant portion of those emergency room visits are filled with people who have behavioral health issues. We use a telehealth program, so we actually use we call it our telepsych program. and we have a robot that is the vehicle by which the patient can receive the psych evaluation. Now, there's nothing warmly human about a robot and a person inside of a screen that you're talking with. On the other hand, we've seen a couple of those robots attacked physically, and it was probably very safe for the provider because the provider was not physically attached to the robot that got beat up. But it hasn't changed our need to add staff. But what it does do is, I think you mentioned business opportunities. There are whole organizations now staffing up to provide all kinds of telehealth capabilities. And it isn't just psych, it's any kind of thing where you need another provider. And telehealth is sort of, sometimes we think of the really fancy things about virtual visits and so on. But even at our hospital, translation services are provided through, the nurse carries an iPad, and the person you're talking to inside the iPad is effectively someone who is a native speaker for your own language. So it's a way of leveraging technology to get more resources in front of this higher demand. It's not a substitute for those real resources, but sometimes you have to do the best you can.
So we've had the opportunity to do hundreds of studies looking at various aspects of telehealth video visits over the last 3 years. And the most successful in terms of patient satisfaction that I know of has been telepsychiatry. It's a difficult patient population anyway. They rate their satisfaction as 95% with our video psychiatry visits, which is higher than they give with the in-person visits. Because they don't have the stigma of having to physically go in. They prefer it. Our providers prefer it. We now have providers that are doing these things from home, so they don't have to come in. And the other thing that's really great is, from a logistical standpoint, we can arrange cross-coverage. So if Panorama City is having trouble and Woodland Hills has extra capacity, we can share our capacity and make for a more efficient way. And we can leverage third parties. If we need to pull in vendors, we can pull them in virtually. And I think we're going to see a whole bunch more of that in the future, as Brennan was discussing a minute ago.
Yeah, if I can just add one last point to that. Humans are really important when it comes to psychiatry. You know, if you, as an exercise, when you get in your car, ask Siri, or just say to Siri, "I feel sad," and wait to see what she says back to you. I'm serious. We recently had an expert in artificial intelligence come to Cedars and talk to us about the chatbots and other available robots and how they manage complex biopsychosocial exchanges. And it's embarrassing in some cases. Not to say the chatbots don't have a role for limited, relatively simple conversations. And we haven't touched on AI today, but my overview of that, it's not even close. So that's another discussion for another day. Telepsychiatry is terrific because you have a human talking to another human, and the fact that it happens to be electronically transmitted has nothing to do with the therapeutic efficacy of that intervention. But I am still concerned about chatbots and AI and machine learning robots. I've spent a lot of time looking at them, studying them. They're not there yet, certainly not for serious mental health issues.
I saw a hand over there. Yeah.
viewing of the opportunity you mentioned looking at where the emphasis is with technology, and actually planning it rapidly with limited resources.
Yeah, I'll just touch on that and see. I'm sure everyone has a thought about that. I think it's a great opportunity, and I think it's feasible because everyone could win if it's done correctly, right? You can create a digital ecosystem that incentivizes everyone to participate. There's all sorts of pockets of patients that none of these health systems are accessing right now that they could if they use digital health in an efficient, effective way. I think, the problem is that we haven't even gotten basic issues like interoperability fixed. So that's the issue where, one electronic health record can't talk to the other. People have to print out and put on CD-ROMs and walk their stuff across the street from one hospital to the other if one's on Cerner or one's on Epic. So to think that all of a sudden we're going to create, not all of us, not that you're suggesting that's going to happen, but the caricature is, all of a sudden we're going to have this kumbaya moment and everything. But I think with the right planning and the right leadership, particularly in a place like the Valley, where maybe there is such an opportunity, there is a way to have an overarching strategic plan. I really do believe that. I don't know that I have the blueprint for you right now, but I do think that that's an important observation, and it's an opportunity for the environment, for us in healthcare, for our patients, and for businesses. Anyone else's thoughts about that?
I can tell you from having done part of my training in Europe, that's sort of a standard there. And they have a single-payer system as a baseline, even in the two-tiered systems like in the UK. And regionalization is their standard operating modality. The problem, as you hinted at, is what do we do about capitalism and competition? And I think that whenever society is ready to make that decision, I think the electronics portion of all this will make it much easier to achieve than it would be otherwise. But they've had that in place in Europe for decades now.
There are large group practices in the Valley right now who are pretty upset with how some health systems have come into their environment, without speaking about any one health system. But having worked with many of those and trained with many of those, they're really upset right now. And they've been working in this community or their communities for decades. And all of a sudden, here comes another building across the street with an imprimatur, on the front, and they're having to sort of fight for their lives. It's an existential threat. So that's not the best environment to figure out how we're going to solve big issues like this. But it's just more of a symptom of how our healthcare system is dysfunctional. And even in an environment like ours, where we do have enough people and space for everyone to win, that's not the attitude that in general has been seen. But although I have started to see much more cooperation between health systems, and there are good examples of that. Vivity is one example. The new combined hospital that UCLA and Cedars have, the rehabilitation hospital. Those are examples where big things were achieved with leadership across health systems. So I think if that could be done, then something like this can be done too.
Yes.
So more recently, there's been a lot more focus, moving a little bit away from wellness care, disease management care, and really talking about how this health can develop social determinants of health care along with our traditional models.
That's right.
How do you see technology embracing this other facet that's extremely important, which is caring for patients with social determinant needs? And how do you integrate that into a plan reflecting on the book settled here?
I think this is
I'm
one.
happy to take it. I just don't want to.
This is
Another multi-hour.
yeah. I think one thing to just think about is once again, it's that there's a consumer aspect to this, and there's a provider aspect to this. And I go back to the 0.7% comment at the beginning. It's not that people aren't using those technologies. They just don't see a personal connection as to why that needs to be something that is important to a health system or a health care provider organization. So I think that when you talk about managing people's health and maybe the social determinants of that, I think there's still huge opportunities on the consumer side. I think our challenge when we represent providers is simply how do we take that tendency and move it towards some form of population health management of some kind that we are in some ways on the hook for as providers. I think there's a ways to go on that because I don't know yet what the consensus of the general population is going to be about all of those tools. But if you want to think about a population that has enough tools to manage their own health, we're looking at a time when that is very possible. When I say manage their own health, manage either the disease condition that they have, whether it's diabetic or weight management or any of those other kinds of things. So what we have with exercise and Fitbit is just one example of many other kinds of conditions that can be managed. But an individual choosing to manage that and a provider organization ready to connect that into a holistic approach, that's a challenge. We're not there yet.
I would say that it's vital that we leverage social microsystems and take advantage of them for our benefit. I'll give you an example, because you're absolutely right. Social determinants of health drives provider decision-making, behaviors. It's completely under-recognized. For example, I happen to be a gastroenterologist. So African Americans have the highest incidence and prevalence of advanced colon cancer of any group in the United States, and they're underscreened. They are screened less than any group in the United States. Why is that? Why is it that African Americans consistently are underscreened? There should be no reason, but there are many reasons, and we spend a lot of time trying to understand those reasons. And if we're going to try and create some kind of public outreach or app that improves, colon cancer screening rates, we better be very clear about the differences and address them proactively. So an example is, I mentioned we worked with a church in the West Adams district of Los Angeles, which is a largely African-American church, and we took advantage of a relationship that our nursing research group has at Cedars Sinai with that church and with the pastor, Calvin Sauls, who is a visionary, not just as a spiritual leader in his community, but he views his role as a health leader. He sees his remit as improving the physical and spiritual health of his parishioners. So we worked with him and his parishioners with focus groups to find out why is blood pressure so high in this church. And it turns out it has a lot to do with diet, culturally, tailored diet. And there's a lot of salt in the African American urban diet. There's a lot of salt in the Caucasian diet too, but they're particularly high salt. And we developed with them a virtual reality program I just referred to earlier that addresses some of the cultural beliefs around salt. It's literally, you fly through your body and see what is happening to your body as salt damages your brain, heart, kidneys, and blood vessels. And then the pastor comes on and starts talking in the virtual reality on a beach to the parishioners and says, listen, do you want to make a difference in your life? Like, do you really want to change what you're going to do in your life? We lowered blood pressure by 7 points by using a virtual reality program without any medications. One guy got off medications, he dropped his pressure by almost 80 points. It's incredible. So there's going to be the LA Times covered this recently. So that's just an example where, this is, just because we have apps and technology doesn't mean we can ignore the social determinants of health. They have to be addressed in all of our solutions.
Well, that's quite the godly message. Ellen.
we're seeing great movement in this space as people are identifying that it drives so many of the high utilizers. If you look at high utilizers, somewhere around half of them have an unmet social need. And so hospital and medical systems are increasingly realizing that this is a big enough deal to their bottom line that they have to get involved, which I think is wonderful. The methodology that I'm seeing right now is one of being the connector. There are a lot of resources in the community that go underutilized. People don't get connected up to the right thing. We also are at a time when the 2-1-1 movement is really taking off. And so we're having some good resource networks getting built up. And at least for the moment, I think that's the model that our hospitals are pursuing, is figuring out how to get people plugged in with existing resources, because we can't buy people houses and food and still stay in business.
Just want to add a quick point, because I know we're wrapping up here. I think part of the issue is there's too few people trained in knowing how to do these things. So we've created a new master's degree program at Cedars Sinai. It's a master's degree in health delivery science. And all of our students, we take 20 per year, learn digital health science, health economics, social determinants of health, health analytics, quality improvement. Those are the fundamental building blocks to create programs that reach out and within the hospital system to try and drive value of care using all these modern approaches. So we just started that program this year, and we're very excited about it. It's an accredited program.
So I know that all of us can probably go on for another 10 hours on this, on the various topics. Fascinating with our wonderful panelists. I think I know one of my key takeaways from this is that as innovative and as fascinating and as good as technology is, technology is only as good as we as humans are in thinking through some of these big policy, social issues and challenges before us. So I hope this has been a helpful discussion. I hope it sparked a lot of interest and thought, and we can certainly continue that conversation during the break. I believe the next session starts at 11. But let's again thank our sponsors, the Garland, Kaiser Permanente, Levitt Group, and Valley Presbyterian Hospital. And please, let's give our panelists a round of applause. And just a friendly reminder, if you could please fill out your survey and provide those filled survey copies to VICA staff. We've got Armando and a couple other places in the back. It would be much appreciated. Thank you, everyone, and have a great rest of the day.
Thank you.
Okay, yeah, thank you. Okay, good morning, everyone. How's everyone enjoying the conference so far? It's off to a good start. Welcome to the filming panel. Filming being one of the true economic engines of our region. Really don't need to say that, but it's so exciting to have this panel here with a great group of distinguished panelists. I think you're really going to enjoy it. My name is Kevin Tamaki. I am chair of the board of VICA. Also, I'm with AT&T. I do public affairs for AT&T. And how about those Dodgers? Yeah. Yeah. So exciting, so exciting. I'm just too excited. AT&T is also a sponsor of this panel. And also like to thank our generous track sponsors, the Garland in North Hollywood, and Kaiser Permanente. And so I have the pleasure of introducing our moderator for this panel today. This morning we have Sarah Walsh, who's Director of State Government Affairs for the Motion Picture Association of America. She's also a very active member of VICA's Entertainment Committee. And that's one of the real truly valuable pieces of VICA in terms of advocacy, is that we have not only great members, but they participate. And the Entertainment Committee has representation with all the major studios, but also a lot of the companies that are more, I guess, below the line type of companies as well. So we kind of cover the gamut there. And they do a really good job of providing the board policy direction for making sure that our legislators do the right thing by our region. The biographies of each of the panelists are already in your program. So I'm going to give very brief introductions here of our panelists. And first we have Kevin James, who is not only the president of the Los Angeles Board of Public Works, but also is a director and chief liaison in the mayor's office for film and television production. Next we have Michelle Kempner, vice president of operations for Buzzfeed. Next to her is Amy Lemisch, executive director of the California Film Commission. And finally, we have Tom Lynch. Tom is CEO of the Tom Lynch Company. So thanks everyone for your attendance here. Look forward to your questions, and I'm going to turn it over to Sarah. Here's the mic.
Great, thank you, Kevin. Again, my name is Sarah Walsh. I work for the Motion Picture Association of America, and I'm looking forward to being your moderator for the panel today. Just a few housekeeping measures. At your seat, there's an exit survey for this panel. It's this piece of paper. And I encourage you to fill it out at the end of the panel session and return it to the VICA staff or a VICA ambassador at the back of the room, or you can also turn it into the registration booth in the foyer. VICA needs your feedback in order to prepare for next year's event, so please take a couple minutes just to fill out the form and return it. We have a great panel lined up to discuss the ever-evolving concept of entertainment and its impacts to creators and business and government. And so I'm going to start by giving each of the panelists just a couple of minutes to make an opening statement, just to get things started, and then I'll start in with some questions for each of the panelists, and then open it up for questions from the audience. And so if we could just start to my right here, I'll start with Commissioner James.
Great, thanks, Sarah. Again, welcome everyone. It's great to be here. It is really remarkable what's happening right now in the industry, and particularly right here in the city of Los Angeles and indeed the region in relation to just entertainment content, digital media content, really across the board. When Mayor Garcetti took office in 2013, we knew that the coalition, of which we have members here, would be going back to the state legislature to get a film and television tax credit that would be able to compete with the tax credit programs that existed around the country, indeed some of them internationally. And we also knew that all we had to be really was on the playing field, and we would have distinct advantages. We didn't have to match the amount of film tax credits, although I would like to, and I'll get to that maybe a little bit later, but we knew that we didn't necessarily have to match New York to be able to compete with them directly, because the best talent in the world is here. And that really is above the line and below the line and everywhere in between. So in addition to that, the infrastructure for the entertainment industry is here as well. And so those were some distinct advantages for us. And we knew in the administration that with the passage of that tax credit, we were going to see real increases in production up and down the state, and in particular around Hollywood, of course. So it passed, and indeed we've seen those increases in production. And because of that, the mayor created the first ever, you'd think that this might have happened in the city of LA before, but our research indicates that it didn't, the first ever Mayor's Office of Film and Television Production, and that's what I oversee as the president of the Board of Public Works. The mayor moved the budget for that office, which had been in economic development under the Board of Public Works. We deal with the permitting, obviously for films through our permitting contractor, Film LA, but most importantly, we deal with every city department in ensuring that the the entertainment industry across the board, whether it's music video production, commercial production, digital production, film production, television production, feels at home in the city of Los Angeles. And we have a concierge service, we like to call it. We deal with legislative issues at the state legislature, at the federal level, obviously at the local level. These are people that I work with pretty much all the time. We work with Amy regularly on the tax credit issues, Sarah just about every day on all kinds of issues. Buzzfeed is a member of our invited participant list of our Digital Makers Initiative, which I'll have a chance to talk about in a little while. So there's just a ton of things going on, and I'm really glad that you joined us for our busy discussion this morning.
Michelle?
So BuzzFeed, as you may know, is a news and entertainment company. And we really started and originally got famous for our lists or listicles. But what's really unique about BuzzFeed and also makes it a really fun place to be is that we have a very highly autonomous group of employees that develop crushes on different things. And they, with these crushes, create media or entertainment or news using whatever technology and media makes sense for it. So about 5 years ago, we began producing videos out in Los Angeles. Our offices now are located in Hollywood, which we love, being part of Hollywood. And we really make content for whatever, wherever our audience is and in whatever way resonates with them. So that means we're partners in Snapchat Discover. We make a ton of YouTube content. We were really early on Facebook making native videos. And we're really just, like going everywhere and trying everything, including doing longer form content and starting to look at television and feature-length films. And then part of my role at operations is to kind of be the wrangler on the outside of all that and figure out how to work with Film LA and work within the larger entertainment industry in California.
Thanks, Michelle. Amy?
Yeah, hi, thank you. So, yes, I'm the Executive Director of the California Film Commission. We are a state department within the Governor's Office of Business and Economic Development. So our main mission is as an economic development department. Our whole purpose is to see that we increase production spending, jobs, and all the small businesses that support the industry. We want to see those growing and thriving. So that's our primary goal. To do that, we do a lot of things. Yes, we administer the tax credit program, which Kevin talked about, and it seems to be most of interest to the public of our services. But we also do a lot of things. We do the permitting for all state properties. We interact with Film LA a lot because there's often an overlap. We do a lot of troubleshooting, problem solving for productions on any government level, city, county, state, federal. If they hit a roadblock trying to get access to a location, for instance, they will often call us and we help strategize and figure out a way to solve that problem, going up the food chain through the various government bureaucracies. We have an extensive digital location library. We do marketing to encourage productions to come to our premier filming destination, which is California. We partner with a network of about 50 local film offices, all the way from San Diego up to Humboldt County. We do joint marketing. We do joint events. We host a conference every year. So we're working together with all of our partners, the City of LA, Film LA, and all the other local film offices to make it easier for people to film here.
Thank you, Amy. Tom?
I'm flattered to be with such an auspicious group up here. I'm a simple writer that had to build a company around it so I could produce content. And currently we produce content all around the world. We have shows going on in Europe and Canada, here in Los Angeles. And this time, there's more content being produced than ever in the history of television, or media right now. It is massive, and it's an incredible time of disruption. Companies like Buzzfeed and those things changing the game. And what we provide is, hopefully, the highest quality content for kids and family. And I just came back from MidCon in France for 4 days, and LA is still the center of that whole world universe of content. I'm kind of proud to say that as Los Angeles.
Great, thank you. So, I think I want to start by doing a little bit of background here. As you'll recall, the title of this panel is Lights, Camera, Phone, Action. And so I'm going to start with a question to Michelle, but I hope other panelists will jump in and respond as well. So I guess sort of by way of background, we're talking here a little bit about not just the traditional programming and things that you might go to the Cineplex to see or flip on network television, but more short form content and other options for entertainment. So, Michelle, I'm wondering if you could talk a little bit about how you've seen content change over the last 5-ish years and a little bit about the appetite for short form content and how that's increasing and how people get their entertainment these days.
Yeah, so it's a really interesting question because when you work in digital media, your connection to the audience and feedback loop is so tight. So I imagine you go through the same thing working in the film industry, but the cycles and the feedback, you have to invest millions of dollars in a film and then wait a year or however many years to get it back. Our feedback cycle is so tight. At the same time, we're working in a constantly moving environment and ecosystem. So I'm actually doing a talk next week where I'm going to talk about how do you like figure out a platform when you're like, I want to be big on YouTube or I want to be big on Facebook. And one of the things I say is you have to read between the lines. So when Facebook introduced native video, everyone was just used to what YouTube had and had adapted their content to work for YouTube. So when Facebook introduced native video, they said, it was pretty surprising at the time. They said video is going to autoplay, and everyone said, but then what about the audio? And they said, well, it'll just be muted, and it'll count as a view right away. If you watch 3 seconds, that's a view, you were interested in it. And everyone was like, that's crazy. But so what we did at Buzzfeed is we were like, okay, well, what does that mean? It means we're going to have to grab attention right away. We're going to have to make content that's audio independent because people aren't going to be like every video turning on the sound. And that's actually how our digital food brand Tasty was born. Because we were like, what could we do really fast? It wouldn't need sound. Oh, we could do recipe videos. We won't have people. We won't have talking heads. And we were able to do that. And within a month, within 30 days of launching Tasty, and we have someone here who was there for it. Within 30 days, we got to 1 million page likes, that's a huge response, and it tells you you're on the right track. So basically, a long-winded answer to your question is we're in this environment where you can really quickly get this feedback. But the other part is making adjustments. So now Facebook is saying, and I'm just using Facebook as a particular example, they're saying like, actually we want to be a destination for shows. We have all these really short videos, but what about longer bespoke content for our platform? So actually we're going to look at watch time. We're going to add this watch tab. We're going to have shows and original programming. So you have a moving platform. So now they're changing whatever magic algorithm is showing people things in their feed, and you have to immediately react and say, okay, what are things we can do to appeal to that? So about 2 weeks ago, we had a video perform very well with a Holocaust survivor telling her story. So it was the exact opposite. It was a talking head. You really needed audio, but it was a compelling story. And because we were able to make enough content and read the signals fast enough, we were able to adjust. So then last week, we followed up with a video, which we previously put on Facebook, had no big reaction. We put it up again, and it was a story of someone telling how they jumped off the Golden Gate Bridge. It was a mental health video. They survived. But because we were able to read the signals so quickly and identify the moving platform, we were able to see like, okay, now people are ready for this. Let's put it there for them.
Tom, could you maybe talk a little bit about how some of the things Michelle has mentioned intersect with more traditional companies and what Tom does a lot of work with both traditional media companies and others and how they're adapting to this and what you're seeing in your work.
What Michelle was talking about, getting attention right away, doing something that's compelling story, those are the classic elements of entertainment, and they're always in demand. Today, what we have is audience so spread out. It used to be, you had the major networks and some syndicated shows. It wasn't that long ago, and now you have all kinds of, you have a 400 series universe and scripted series. You have, I can't tell you how many platforms you can watch television on, and you can watch video content on. So her rules are the same as ours. So we have to attract an audience. That is our job. And as a creator of content or running a company, but we have to. I differ. She's probably right, but I differ in the idea that we have to read the lines. We have to stay ahead of the lines. We have to always bring out what's next. Because my belief in more traditional television, I sell a television show, it'll be a year before you see it. So I have to be that far ahead of public taste when I take it out there. Buzzfeed, they have the immediacy, they can turn material around quickly, and so they can live in that space and be very, very current. Our bets are always placed, what is the next change in culture? And that's kind of one of our determining factors. Where's pop culture going? But it's still the same thing, compelling story and get the audience quickly because they have too many choices. I've changed my mind on screens, and I was one of those people that said, why would you watch a movie on a telephone? And then I actually watched Lawrence and Arabia on a telephone instead of playing all the time of litmus test. And I love Lawrence and Arabia. It's my favorite thing ever made, and I loved it because I could watch it on the phone. I could watch it whenever. Maybe it's just my time in life. I enjoy the big theater experience, but there's nobody who's not going to watch that movie because it's a great story, it's a compelling character, and you get into it right away. He dies at the beginning. You got to see what happens. So.
Definitely. Thanks, Tom. Amy, how do some of this new content, some of these new companies, how do they fit into the existing ecosystem of production, and how does that impact the California economy and the work that you do?
I mean, from our operations, we treat every type of production equally, whether it is a no budget student film to a YouTube content production to a big Marvel production. We're going to offer the same services that we do to everybody. Really, the way I see it is that in order to have, and we do have, I think, the best production infrastructure in the world, but in order to maintain that kind of superior infrastructure, you need all types of productions at all sizes and budget levels. So in order to support the really big tentpole projects or the big high impact television series that spend a lot of money and create a lot of jobs and economic impact for the state, how's everybody getting their training, and how are they learning how to be those highly skilled technicians that we always brag about? We have the best skilled crews, we have the best in front of the camera talent, we have the best resources. They have to get their experience somewhere. So whether it's working on student productions or low budget features or YouTube content, or it's a training ground for our crews, really. So that's how I see it. It's important to help all of these different size productions because it all builds to the greater economy, I guess is how I would sum it up.
Right. And this, I think, goes right into what I'm going to ask Commissioner James to talk about, which is what are some of the unique challenges that some of these smaller companies face when they're filming here in the city, from your perspective? How does permitting and those kind of issues have to be adjusted for these types of productions? And I hope you talk a little bit about what the mayor's office is doing with the pilot program you mentioned that Buzzfeed is part of.
Sure. So first of all, Paul Audley, who is the president of Film LA, who we work with obviously on a daily basis, I heard him say, I was sitting on a panel with him, Amy, you might have been on that panel, when I heard him say that for the future of, that digital media is the future of film permitting, which I kind of had to do a double take to hear Paul say that. They're seeing, in the last 5 years, they've seen a 400% increase in permit applications for digital media content. Now that's for standard film permitting at Film LA. And most of those film productions, I would venture to say, probably aren't getting permits. And the first time that we brought in our partners at Buzzfeed and Tastemade and 72 and Sunny, Me Too, and the other partners that we have in the pilot, it took some time to become familiar with their business model, for them to be familiar with what we're interested in, and it took several months to work on the pilot. For us in the mayor's office, we see so many benefits. As Amy said, one, it is a training ground on so many different levels for larger productions and for a career in the media and entertainment industry. Secondly, for us, it breaks down barriers to the entertainment industry. Young people and people from all different backgrounds can have their content seen now because it can go up online. I always use this example of this movie Lights Out, which was a Warner Brothers feature that was made for $5 million, but the concept for it came from a 3-minute web video that a producer at Warner Brothers saw, and it was a young fellow from Europe that came over to be able to direct his film. They wanted it shot here for a number of reasons, but it was his first feature, and they wanted it done close. And so we were able to, the city, to find locations for the production that enabled them to stay here, and they shot free in the city of LA at the old bank building in Highland Park. And they used it for everything except I don't know if you saw the film, it made $65 million. So there's another one coming. But other than the residential scene, everything was kind of made around the old bank building in Highland Park. But we know, and what Film LA realizes, is that most of the budgets that BuzzFeed and Tastemade and 72 and Sunny are seeing are well below that. And in Michelle's world of digital media content, their budgets are on the higher end because they're on BuzzFeed or they're on some of these content providers. If you look at some of the indies, as I'll call them, their budget might be $100. And so you can't charge them $660 for a permit. And that's our segue into the reason that we approach them for what we call our Digital Makers Initiative. It's a pilot program right now, and the reason that we have the 6 invitees that are all of these existing companies that put this content up on the web now is because of the insurance issue. They have insurance for the people that are producing content on their networks. Those that are the indies don't have insurance, and so that's been, and we're working on that today as we speak, getting over that hump. We're kind of using, just to make our explanation short on it, we're kind of using the travel insurance model. I can fly to New York and buy a $500,000 travel policy and pay $41.95 for it. And we know that the insurance for a shooting day in Los Angeles, we require $1 million deductible. We're going to get that, or $1 million coverage. We're going to get that. $1 million deductible wouldn't be very economic. Trying to $1 million, it's an expensive place to film. Trying to get that the $1 million coverage for these productions, I think we'll have success at the city level, getting it down to $250,000. Then we're looking at the city being an umbrella type provider with a partner, so that anybody that seeks one of these permits through our Digital Makers Initiative will then, for an additional $40 or whatever on top of their cost, be insured. And so we're still trying to get there. But in the meantime, we had this 9-month pilot that literally started on October 2nd, and these permits are being pulled right now, and we're kind of learning best practices from them. And they're learning about our process, and we're learning what our city departments need. The basis on this was not the identity of the company. Some of the studios were concerned, well, wait a minute, are you cutting a break to these entities? No, that's not what we're doing. The studio can be putting out that digital media content. If your footprint in the neighborhood is that small, then you too can get the cheaper permit. It's not based on who the company is. It's based on the size of the footprint that you create in the neighborhood and in the community by filming your project.
Thanks.
How is the IA, Teamsters, all that going? Are they part of the pilot program?
They were consulted and they know about it. And as we go forward, they're not part of it specifically, but as we go forward, we expect to bring them in.
Thanks. And I think to your point, Commissioner, MPAA represents the 6 largest studios, and although we're typically known for producing traditional content, features, and television network and cable television, our companies are all doing this short form content to support a lot of their production. So for marketing purposes, um, all sorts of reasons, they're engaging in this type of production as well to create buzz around their work and doing some really creative things, including with VR and AR. And so we're pretty excited about this new content space as well.
And a number of those digital media content providers, if you talk to their leadership, they want to be acquired by some of your member companies. I mean, that's part of their goal, and some of those acquisitions are happening. Yep. That's one reason we figured that we could get them to the table with permitting. But you know, the larger program is going to be a larger challenge, and we know that. But that's the reason for the pilot.
So
it's the first pilot of its type in the nation, by the way, and we know that the other cities are waiting to follow the lead in Los Angeles and see how we do.
So adding on to that, we talked a lot about the different kinds of content, and Tom mentioned the huge proliferation of just television. There are over 450 scripted television shows available to watch right now. That does not include reality television or game shows or sports programming. It is a ton of content. And so maybe for Michelle and Tom especially, there is a discussion happening, and I'd be interested to hear your thoughts about, can there be too much content? Or is there a saturation point?
Absolutely not.
Yeah.
I think it is content is part of the cultural experience, the global cultural experience. It is air. People watch content, no matter we film China, Africa, South America. It is ubiquitous. It used to be the kind of Hollywood controlled it all. It's out of the box, and it is a global force. The benchmark is what will always work is the quality of the content, and that quality is not only physical quality of production, but also intellectual. What are the new ideas? What are the new imagery? What is the new stars? That is what will drive the content. That will always keep a place. I believe that will always keep a place at the table. Conversely, there's what I call tonnage. There's material that is just made on the lowest end of scale without any thought, and that fills up various networks and platforms to give them something to do. It gives them something to stay on the air and stay on there to have some kind of content. It's low cost. And the hope of every studio, major studio, and I know all your people there, is to find that lowest cost thing that will make them the most amount of money. So they will keep engaged in that. So I think it's like anything that uniqueness. The one thing that content has historically, and I believe will continue, is the uniqueness of it. Will always give it value, and that's what I think. There's never too much. Keep looking for the best.
One of the fun examples that Jonah, Buzzfeed CEO, talks about a lot is an early hit we had that was a post about being left-handed and like problems that left-handed people have, and we followed it up with a video, you know, and all kinds of things that as a right-handed person would not occur to you. And you would never like launch a media company or start a film or start a big project and be like, it's gonna be for left-handed people, right? Like it's literally a joke on The Simpsons that Ned Flanders has the left-handed emporium. But when you're making content for the internet and you can harness these niche audiences, there's actually millions of left-handed people in the world. So I would argue that there's can't be too much content because there's so many of these untapped niche audiences that we're still not making content for.
Right, so that's interesting. But I would suspect that if you were producing content for a small niche audience, that you're going to need to keep costs down because the profit, you know, you only have so large of an audience that you potentially would be able to draw in. What I wonder about is I'm seeing these scripted series with per episode budgets like I've never seen. I cannot believe how many different companies are producing this very high-end content. you know, HBO and Netflix and Amazon are operating in these very sort of stratospheric budget levels for these TV series. Now they're a subscription base. I guess it's working, and they're gaining more and more subscribers because of this very high-end content. But I do wonder how long that can be sustained. You know what I'm saying? Like how how many more subscribers can they keep getting to maintain these very high budget productions? I love it because it's like these.
Right. It's great for the
Each
consumer.
episode is like
yeah.
a feature, and we have all of these going on all over the state. But I do wonder how long that can be sustained.
And didn't Jeffrey Katzenberg just, there was a story in Variety, maybe, he just entered that arena of high-end, mobile content for the smartphone. So,
$2 billion he's trying to raise for the global market because it's so, he believes that will be the next thing. It's interesting when you talk about the high-end content on television. I can remember the same discussion going on with feature films where, oh my God, we made that star 10 million. We're going to put the film business up. Oh my God, Jim Carrey got 20 million dollars to put it out. And film business, I mean, they have their challenges, but they're still making those $150 million movies. And it's not to say it's a balancing act. The subscription networks need those big hits because they live on churn. They have to get subscription. They have to get it. Game of Thrones gets you that. The Handmaid's Wife blew Hulu up from being maybe we'll go talk to them, to being a major place. And those are 10, 12 million an hour, that kind of thing. So I think the masters of my universe, as I refer to all of them, because I'm out all of those ones, they'll always have the high end with the big stars that they can promote and get break through the noise, but they'll also shore that up with lower cost programming that they hope is a breakout show.
Tom, could you talk a little bit about, you touched on it, but whether the trends in production or really in consumer interest are different outside of the United States, internationally? Do you see differences there in terms of the types of content that we're seeing internationally? I mean, from our perspective, from the film studios, on features, we're now getting more of our revenue from outside of the United States than we're getting from inside the United States. And so our companies are thinking a lot about when they're producing content, how will it appeal to an international audience? Because we are increasingly dependent on international box office and home video revenues and all of those things. So I wonder if you could talk a little bit about your experience.
I think when studios talk about them bringing more revenue, it usually has to do with an action film. Action films that would drive them. And that has always been up till now has been a truism that action films perform well and action shows perform well internationally because the dialogue is less important to we're visually seeing the dialogue. It's a cop chase, it's a martial arts thing, it's a fantasy piece. Everybody understands what that is right away. We being the U.S., drive the international market. Everyone looks to us. No television show works without the U.S. market. We'll have some rare exceptions where the BBC may fund it and drive it, and then it comes here, but those are 0.01% of the content being made. In our area, which is kids and family, we see that more now than 10 years ago, certainly more than 20 years ago, and radically different than 30 years ago, the family unit is all similar. It's all these people want to see what diversity used to be a terrible thing to sell. People would say, we can't sell a show internationally with a diverse cast. And now the world is seeing, and as the world really is, they want diverse cast. That's not a barrier anymore to salespeople. Action still works there, here. Animation is huge. But we still drive creatively. It's America's greatest asset in the arts as far as our creative ability. And we do still have, I don't say we have the oldest film culture. We don't. We have the oldest commercial film culture. India has the oldest film culture. But India we were over in Bollywood. I was shooting actually in Bollywood, which is an incredible experience. And it's crazy. You have 100 people moving one lamp around there and equipment and stuff. And you're like, oh my God. Well, it's because labor is so inexpensive there. And it's unprotected. But a Bollywood show has not yet to break out here in the U.S. Many U.S. shows break out in India. So we touch the hearts and minds of people. We're all human, and we have that commonality amongst us, and I think that's where the best shows are. Game of Thrones touches people all over the world for its adventure. So we are similar yet regional, I would say.
Kevin, could you talk a little bit about the pipeline? And it's related, I think, to the pilot program, but bringing people into the system, educating younger filmmakers and others about how to work in our city streets, how to be part of the larger film ecosystem, and how does that, we've got all this content, somebody's got to make it. How do we prepare people to be those people and bring them into the system and encourage that kind of development?
Yeah, well, first of all, the pipeline is changing so much. I mean, there was the process of the traditional method, which was the film school, and we have the best film schools in the world here with USC, UCLA, New York Film School. I mean, you can just go down, they have all these film schools here. And we have worked with the film schools for many years. It's predated my time with the city. You know, it's a necessary and important process. But the digital content world has changed everything. As I was mentioning before, you know, young people are making content now on their phones, and some of that content is getting attention. So there's a lot of more, I think there's more on the job, if you will, experience that's happening. They may not intend that it's commercial. It may just be for their friends, and somehow something catches someone's attention, and it's commercial production. And for us, we really work with our partner. I noticed that Paul Audley heard that I had mentioned his name, quoting him earlier, so he hurried into the room to defend himself. No, I mentioned, Paul, your statement some time ago that, you know, we're looking at the future of the film world with digital media content, and the increasing in the applications that Film LA is seeing. But there is a method to working with any city, in any community, in any neighborhood. And we're so diverse, which is an amazing thing about our city, but all those issues are different. And the location managers on the larger budget productions, they know what to do, but what we have now are lots of new location managers that have never been location managers before. And Film LA, as our city contractor, one of the things that Film LA will say is, we work with the city of LA, and so you don't have to. And it's whether it's city of LA or it's other municipalities. But there's a learning curve in working with any municipality, and that's really what our office is there to help ease, if you will. I called it, I think I mentioned before, our concierge service, where typically we are contacted when there is a problem, but sometimes we hear from folks that are coming to LA to shoot their first project, or they're considering Los Angeles, or our city or our region as their first project. And we have people that their job is to communicate with them and kind of tell them where to start. And there really is kind of a training process. On the Digital Makers Initiative that I mentioned a moment ago, Film LA crafted, created, developed, authored with a couple of people in our office. Edgar Garcia from our office is here as well. Our office is growing, which is a great thing. But a training program for the city departments as well as for the participants in the pilot. So that is constantly happening as well.
I'd love to mention a counterpoint, which is, and it's something that Buzzfeed thinks about a lot, is this idea of the higher production cost for the bigger type of media. And a funny thing happened recently where Snapchat, a platform that was built on people with their phones, just doing a quick 10-second video, they've been incentivizing creators to make shows. So the other day, next to our office, this whole swath of Sunset Boulevard was shut down. There were all these people standing around, and we were like, oh, cool, what's shooting here? And they were like, oh, it's a Snapchat show. And we went and looked, and the DP had like a giant steady cam rig and literally had a phone on it. And we were like, so we really also have to think about like I think to Tom's point, like what's good content and what does the audience want? And I don't think anyone watching Snapchat has ever been like, I wish they had spent a little more money so it should be like a little steadier.
Thanks, Michelle. Well, I think maybe we'll open it up for questions for our panel. We've got about 20, 25 minutes left, and we'll see where we go from there. So fire away. Questions. Thanks, and I think maybe I'll ask Amy to talk a little bit about what's incentivized under the California production incentive and how the state has acknowledged this issue.
Yeah, so I can address this, I think. First of all, what we're seeing is, I know what you're talking about the visual effects piece of post-production when production shoots here and they might do their picture editing, they might do their sound editing, but then many times they farm out the visual effects to Vancouver or Singapore or the UK or somewhere where they're getting very significant subsidies basically to offset the cost of that piece of the work. We're finding with the companies that have survived, so there were several large companies that just folded, or they no longer, they might have sort of a small office here, but they offshore the bulk of the work. What we're finding is these smaller, nimble companies that work on TV series because it's quick. It might not be quite as elaborate and extensive as doing a Marvel movie type effects, but they seem to have found a niche where they're able to stay here. Maybe they don't have the accelerated post-production schedules for television. They have to like turn it around, and sometimes it's just easier for them to have that all in the same city. But yes, you are correct. So for these larger productions, which are the ones spending $50 million and more on their visual effects, just the visual effects piece of their production, we are seeing that leaving regularly. So our tax credit program that I administer gives, if you're in the program, a 20% tax credit on all of your below-the-line costs, which is your crew, your equipment, your location rentals, everything basically except salaries for above the line, salaries to writers, directors, producers, and actors. So everything except for that gets a 20% tax credit on the spend, including post-production and including visual effects. The problem we're seeing is we're now being successful in attracting back some of these larger movies that are over $100 million, because that we had really lost. Our program caps the credit at the first $100 million in qualified spend. So if they spend $100 million just in their production period for their crew, for their equipment, for their shooting, then they still have another $50 million to spend maybe for post-production. They no longer get the benefit of my 20%. Okay, so then they will then do the whole shoot here, maybe do their picture editing here, and then they will go seek another out-of-state territory to do that work, because then they're going to get an incentive on top of that. So that's the issue that we're facing.
Thanks, Amy. Other questions? No question. Kevin.
Come on, you guys.
Come on.
Stand it up here.
There we go.
Where do you see that going? looking at, you know, like, the furniture manufacturers and stuff like that, you can go augmented reality. Where do you see it going in the future? And do you see it catching on? Because virtual reality, I've seen a lot of returns on virtual reality headsets because people don't know how to use them.
Well, I always laugh because whenever there's always something in the line of talking about Buzzfeed where I end up having to either like curse or use anatomical terms to talk about content that we've done, but just know it's like in regards to what we're talking about, and I'm not intending to be rude. But I've always had that question at Buzzfeed because we'll get incentives from different groups to make like 360 content, VR content, AR content, and I'm always like, what would that be? Like, it's really hard to imagine. Keep in mind, I'm on the operations side, so I don't always have that creativity. But when we were doing 360 content on Facebook, one of our biggest hits was actually this video called "Can You Spot the Fuckboy?" Don't ask me to define what a fuckboy is because I don't know. But it was actually this really interesting kind of scripted piece where you're in a bar with a bunch of men and you can like turn and listen to different conversations, and then at the end there's like a quiz, like which one. But that really blew my mind because that's like not, you know, you're not like exploring a Martian surface or going to the bottom of the ocean. But it's a way of having narrative storytelling, the same thing we always do, but now using this technology. And that made me realize like there's so much potential in this area, and that's somewhere where BuzzFeed can really excel because we can just make a lot of content very quickly and sort of figure out these areas that work really well.
It's tough to follow.
Yeah, follow that up, please, Tom.
I think AR and VR are here. They are going. I think VR will definitely find its level in location-based entertainment. It will be adjuncts to other properties that are out there. I think AR will do that also. The only successful venture I've seen in VR right now was Alejandro Inarritu, the gentleman who directed The Revenant. He did a story on an immigrant, a 6-minute film, VR film, where it was placed you in the middle of a raid, an immigrant raid. The immigrant officers were there, they come in to raid. So everywhere you turn, there's panic, there's this going on. And the 6-minute film is brilliant, and it cost $42 million. So you have art and commerce trying to figure out what technology is. So I think it is, technology will always win. That has been my experience in media. Technology will win. How it wins, I'm not sure. Now we're going to see kids with their iPhones wearing the instruments in VR. I think some of that will be there, but I don't think it'll be in my time. I don't think it will dominate the field. I think I hope my hopes for VR are more in the medical area, and more where I can look at the master surgeon doing a heart transplant out of Harvard, and some local doctor gets to do it in some small town. I think VR is going to have a huge impact on us all, but before it gets entertainment, it will be in the ways of education and those type of environments and things of that nature.
We used VR obviously effectively in our Olympics bid, which was, I was able to demo it, and it was spectacular. what we were able to do with VR with our Olympics bid. So.
What did you spend on that?
I don't know. It was money that was raised, private money that was raised, and money that was donated. I don't know what the budget though was on it, but I don't think it was that expensive. I mean, it was mentioned to me, but I don't. It was a few months ago.
So in comparison, it would have been in anybody else's presentation. It might have been 15% higher because it wasn't 50%.
Yeah, exactly. And I remember being like, oh, that wasn't as expensive as I thought it was, which led me to think that this technology is again making progress. Yeah.
Other questions? Kevin.
I wondered if the panel had any advice for a small startup company 20 years old who needs AT, which is in the process of acquiring another small company on board. And there is precedent for it, of course, this is right here,
double-edged sword as all things. I think technology will advance art, and I think you guys, AT&T is a technological company, from my understanding, you guys are always looking to the future and R&D and all that stuff, which Hollywood companies traditionally never do because they don't think that far ahead. If I didn't have the hubris to give advice, which I am totally uneducated or unprepared or uncredited to give, but I will give it anyways. With all of that power comes great responsibility. And that responsibility, I hope, gets turned to creators. It is the storytellers that have changed culture. It is the storytellers that are remembered through history. We remember Aristotle and Plato. We don't remember who won the Carthaginian War. And I would really think that a company that size has a responsibility to the world, to the global community, to tell great stories about the greatness of humanity.
At BuzzFeed, we're really lucky to get to partner with NBC Universal a lot. So you can imagine that's two very different cultures working together. And a lot of times they'll have me come in and be like, explain why you did this thing, because we want to be more like that. And I'll be like, well, we thought it could work, so we tried it. Yeah, and they're like, but you didn't know it would work. We're like, no. And the funny thing is, nobody remembers like the 10 pages we started or 10 properties we started that didn't succeed. Everyone remembers the Tasties, the Nifties, the Worth It's on YouTube. Nobody's like, what was that show you had? And then it didn't really work, and then I didn't see it again. Like, so I think a little bit of like a more willingness to experiment, even if you don't know. Like when we started Tasty, there was no clear monetization strategy on Facebook. But we knew that if we made something great, the rest would follow. And I feel like that's what really allows you to have this kind of innovation.
For me, it's interesting. I agree with Tom. I think it's a double-edged sword. I'm going to use a very recent example, Kevin, where I think there was some inconsistency between AT&T and their attempt to acquire Warner Brothers and where Warner Brothers would like to have gone but didn't. And we handled it anyway. It demonstrates where I think there could be great benefit there. You're talking about large entities, but on both sides. And there's a lot to learn from and that education really goes both ways about the various cultures and what's important to one entity versus another. SB 649, Senate Bill 649, is a telecom bill that we opposed that is for the build-out of 5G in the state of California. It's a co-location type bill that essentially, we thought, took the ability of municipalities away from the choice and the regulation of where some of the above-ground infrastructure could go. And from an entertainment industry perspective, it was interesting. AT&T wanted that to pass, and Warner Brothers probably wouldn't admit it. But if you ask Warner Brothers, they would tell you, no, we don't, because it had the potential to interfere with the streetscape of on-location filming in Los Angeles. And so the governor, it passed both houses with some opposition, but the governor vetoed it. We know that it's going to come back to us again, whether it's in federal form or another state form, but maybe it comes back as a better bill than what SB 649 was. But you're always going to have competing interests when you have these companies that merge together. I guess I'm kind of on Michelle's bandwagon of collaboration and mutual sharing of information, because I think you end up with a better product that way.
Thank you. Any other questions for our panel? We've got a little bit of time left, and I was hoping maybe we could go down the panel here and have your thoughts on the future and maybe what we can expect in the next 10 years from your perspective, maybe 5 years.
Can I ask one question?
Yeah.
If anybody on the panel has any thoughts on the the esports industry, because I see it, and our economic development office and the mayor's office is looking at it as significant opportunity for us in Southern California and the state of California, particularly because of Silicon Valley and Silicon Beach, and it is a market of generally young people. It's probably 90% young males at this point, but I think that will change. I'm just wondering if anybody has any thoughts on what of a potential marriage between the entertainment industry at any level and kind of the esports market. Because I was at a breakfast recently, and the two panelists were Peter Guber, who, former head of Sony, who owns one of the esports teams, and the owner of the Golden State Warriors. And they had these esports franchises, and you saw this very interesting collaboration, again, another term we're using a lot today, but between entertainment and technology and sports, visual sports.
Esports in my category, I have kids and teens, it's going to be huge. It's huge now. We're actually developing a series for one of the networks right now around it, and it was based on a story I read where there was a 16-year-old kid who won $1.8 million from esports one year, and he's now 18 and he's on target to win $3 million. It's phenomenal, and I don't understand it, but I'm going down the path. Right. Cool.
And it's interesting. I love to just watch. I'm like a media ecologist. I love to watch what's happening and through history and notice things. And being from a startup background, I've known people who gotten up at 2 a.m. to watch esports because it's live in South Korea, and I've been like, who would ever watch that in the U.S.? This is a tiny thing. But we see these things all the time. Another example is the food content, people eating. Do you know about this? That there are huge stars in Asian countries where it's just someone who eats, and you watch them eating. And it's like, what is that? What? I don't think this is something that would ever take off here. And then lo and behold, there's a whole trending category on YouTube now that's just people going somewhere and ordering a lot of food and eating it. And I watch it. I'm like, oh, that's funny. They're eating a lot of food. So I think it's the same thing where we haven't wrapped our heads around it yet. Meanwhile, it's already here.
Right. That's the future, by the way. Eating videos. Thanks, Michelle.
Sorry, so I just wanted to throw that question out.
Any other questions? All right, well, you're not off the hook. A few predictions, I guess, for the future of entertainment over the next 5-10 years. We'll start with Tom. I'll go that way.
I think it will become better. I think America will maintain its place in the creative art form, but I think America will, for the first time, accept shows from China, shows from England, shows from Latin America in a more rounded way. And I think that television viewing will become ubiquitous. So there will be no difference at all from your home, from your television, from your tablet, from your movie theater. It will all merge into one. And I think there'll be enough work out there to keep me employed for the next 5 years, and I'm pretty good with that. That's
excellent.
Good.
Excellent. Amy.
Yeah, I guess I don't see the proliferation of content going away. I do think that, and I agree with you. This sort of cross-cultural productions because the international marketplace is driving so much of our sort of profit margins and all of that. I think we're probably going to see more collaboration with other countries and talent and that sort of thing. But I do think that these series content producers, I think we're going to start to see some tightening up because what did you say, 450 scripted TV series? Not that there's going to be less of them, but I think that we're going to start to see maybe smaller, more nimble production models that are less costly.
Aside from eating videos.
It's funny because I really want to answer as Michelle, but I think to answer as Buzzfeed, I would say you're going to see more partnership between data and technology and artificial intelligence, machine learning, and content creation. We had a project codenamed Centaur, so half man, half horse, half data brain, half content brain, and I think that's where we'll see things going.
The last word.
I'm the one prediction I will be right about is if there is going to be something in the next 5 years that we have no clue about today. That's the one thing that I guarantee I'm right. I'm going to predict that we don't know what something is going to be related to this space. But things that I think will happen, I think we're going to see trends. Ted Sarandos and Netflix are going to spend money here. Katzenberg's into the marketplace for the high-end content. I think we're going to see more of that with Netflix, Hulu, and the others. I think we're going to see a much more diverse world. You're seeing Me Too and a number of these other companies that are growing significantly and are exciting companies to watch. Tom mentioned earlier, and Amy too, as the world gets smaller globally, and there's much more of a market for content that is as diverse as our world is. We're the best, and for us in LA, it's great because we're one of the most diverse cities in the world. So those two things go together. I think that I mentioned esports. I think we're gonna see huge growth in esports. The number of universities with esports majors right now is probably 5. In 5 years, I think it will be 50, which will be interesting. That's creating a whole new market. Digital media, as I quoted Paul saying, that's going to continue to grow significantly, and we are keeping up with it here. And I think, Sarah, the role of the MPAA is, and its importance, because of all of this, is going to be more significant.
Great. So thank you all for coming. I have a few announcements. That's all the time we have for our panel, but if you'll bear with me here. First of all, let's thank our panel sponsor, AT&T and Kevin Tomato. Yes, as well as our track sponsors, the Garland and Kaiser Permanente. And a round of applause for our panelists, please. Thank you all for joining us this morning. Just a reminder to fill out the exit survey and hand that off to VICA staff, either here in the room or back at the registration booth. And one more announcement about lunch. The luncheon program starts at 12:45. And so in the meantime, please go out and visit the exhibitors and return your bingo card. If those of you who are going around to each exhibitor, return your bingo card to the registration table for your chance to win a number of prizes, including a round-trip flight on Southwest, an LA Rams package that includes tickets to the games and a signed football, or tickets to Magic Mountain. Thank you again, and have a great day. Thank you.
Great.